how much is it to see the doctor?
That's right.
And they said $125.
Unbelievable.
So you're really letting insurance dictate your care
Completely.
over $120. That is your copay. You'll probably get a bill back from Blue Cross saying that you owe $75 for that doctor's visit.
Right.
So I think that we have just been conditioned to think, one, we can't afford it, or two, we shouldn't have to pay for it. And it's an area where it's odd because it's one of the most valuable things you can have is your health and then advocating your health. Yet we don't think that we should pay cash for it.
With this podcast, what we're trying to do is have real, authentic discourse.
Dr. Taylor, it's good to have you today.
Thank you.
I've been looking forward to having you on our podcast. As we were talking about just a few minutes ago, we in Enterhealth decided to launch the Treatment Redefined podcast this year. And really the sole purpose of it was to have intelligent discourse around addiction, mental health, which involves physical health, as we're going to get into today.
Yes.
And so I am so excited to have you on this episode. We're going to cover all sorts of different things related to integrative and functional medicine. But I thought maybe what we would do is just start out with a little bit about your background. Just, tell people, where you got your education, kind of what your focus has been.
Yeah.
And just for the audience to know, you are Enterhealth's Director of Integrative and Functional Medicine. And so you are seeing patients actively. And so anyways, maybe let's just kick it off and talk about, where did you grow up? Where'd you go to school?
Yes. Well, I'm from Long Beach, California. Graduated from high school there. Decided I need to get away from here. Went to Xavier in New Orleans for undergraduate. Majored in chemistry. Applied to medical school. Was accepted into my top choices. I chose USC. Went there. Graduated. And then, you know what? Kind of did a little bit of a different thing. I did internal medicine with the intent of becoming an anesthesiologist. Did that at King Drew Medical Center, Los Angeles County, big hospital in South Central Los Angeles. It was fantastic. Then I went to USC's University Hospital, LAC County, and I hated it. Right? I really did not like anesthesia. I didn't like the people. I couldn't decide if I didn't like the people or if I didn't like the topic. But in medicine, if you leave a residency, you have to be prepared to leave the specialty. So I had to make that decision. So I did. I said, what do I want to do now? So I decided to go back to King Drew, Los Angeles County King Drew, and do emergency medicine. So I re-entered the MAJ, went back there. So now I'm like a third year, should be a senior resident. They made me repeat the whole residency.
Okay.
So I did that, graduated, decided, you know what, I have a kid now, can't really afford to live like I want to live in Los Angeles. We moved to the Bay, and then we moved to Texas so that we could have a lower cost of living. Got here, worked at Parkland, was an assistant professor at UT Southwestern, did all the things at Department of Surgery, and been doing that. But then right around COVID, right before COVID, I realized that medicine kind of wasn't on the right track, and I was at a place in my life where I could not work just for money and time. I could kind of be a little bit more creative. So that's when I kind of got into functional medicine. And so that was 2019.
So right around the COVID time period.
Right before it, right. I had big plans.
Yeah.
And then COVID came and all those plans changed.
It changed. It did. It kind of disrupted the world a little bit.
Yeah.
I think about it sometimes in terms of like history. It's like, well, that was pre-COVID. This is post-COVID. Interestingly enough, and this because this is how we met, but we met post-COVID.
Yeah.
And a lot of the ideas that Enterhealth has had around trying to integrate more physical health, integrative health into the treatment of addiction and mental health really began with the COVID time period. Yeah. There was I'm just going to give you a little bit of context here. I may have told you this story, but when COVID hit, we actually were having these dinners where we take out referral sources and get to know them better. And we had a dinner, it was actually in the summer of 20, and we had a bunch of concierge doctors with us. And it was very eye-opening because we were still in kind of the early stages of, how do you treat this? What should you do? And I was blown away because all of them that were at that dinner basically looked me in the eye and said, whatever you do, make sure you treat this on an outpatient basis. Don't go to the hospital. And that there are ways that you can get over this as long as you intervene early. Yeah. Kind of keep the inflammatory response. Again, I'm not a doctor, but I'm using lay terms. Keep it at bay. let your body do its work and it will rid the virus. And as we discussed that night, the different types of ways that these doctors care for their patients, the time they're able to spend, really even just the diagnostics and objective tests that they're able to run, it dawned on me that, oh my gosh, there's a population of people that are engaging with these types of doctors that get a totally different level of health care than your ordinary PCP experience.
Yeah.
And, that was kind of the genesis of, okay, look at how you parlay this into mental health and addiction. I mean, you can do the 15-minute med checks and run people through and play medication roulette and throw pills down their mouth, but are we looking at things holistically?
Right.
And why aren't we?
Right.
So a lot of questions started to percolate in our head and our team's head. And then I was able to meet you.
Yeah.
And I think we met on a Zoom call.
Yeah.
It was great.
Yeah.
Our head of HR introduced us, and I felt like we were kind of kindred spirits in a way over what we were trying to do and what your passion was at that time. And you came out to our facility, and we began really the beginning stages of trying to put integrative, functional, we're going to talk about these terms here in a minute, really more holistic health care into the practice of mental health.
Yeah.
And so as we've been doing this, one of the things that I've learned is you have kind of coined a term, I believe comprehensive integrative care.
Yeah.
Can we just kind of jump into that a little bit? Let's talk about, because there's a lot of labels that I see with this. There's holistic, there's functional, there's integrative, probably a bunch of others too. What are we really talking about here? Just kind of help tease this out.
Right.
What's going on?
Well, integrative, I think of it as all of the things, right? So you have your ancient wisdom, your Ayurveda, your acupuncture, you have your conventional Western, you have your lifestyle modifications, your dietitians, all the people and forces at play integrated into a plan that honors the whole system that we are, period. So now when you get into the different terms that are out there, it becomes confusing because to me it's so simple, integrative care, integrative medicine. But then what is precision medicine? Well, they use that term to kind of demonstrate the use of genomics, genetics, it's looking at your DNA and tailoring treatments to your DNA, the way your enzymes work. Okay, fair. Then there's functional medicine, which sometimes causes a lot of anxiety for people, confusion for people, anxiety for conventional physicians, right? And confusion for patients.
And you have a lot of practitioners practicing under those labels.
Exactly, which adds to the confusion sometimes because everybody knows this is a doctor, this is a nurse, this is a dentist. But when you have a functional medicine practitioner, it doesn't tell you what they are. It doesn't tell you if they're a dietitian or if they are a surgeon. So you don't really know. Right. But really what functional medicine is, it's looking at the underlying root causes of all the things, disease, health, wellness, recovery, performance. And really, it's what medicine should be. It's what we went to medical school for. Right. So it really shouldn't require a special label. It really is just baseline, right? The problem is medicine has been infiltrated by other entities and stakeholders in hospitals, device companies, pharmaceutical companies, agriculture, like just a lot of players that are not about health and wellness. They have other interests, usually money, profit driven, but there's other interests as well. And they've hijacked, I tell my colleagues all the time, our profession has been hijacked. Physicians are not happy. We're not spending the time with the patients that we need to spend. We're not able to propose the recommendations because it's dictated by CPT codes and what insurance will cover. So if we go back to what we think medicine should be, patients and physicians, it's functional medicine.
It really is, right?
It is. It's not anything special. So when you take medicine, functional medicine, and you honor the patient's story, their preference. So in conventional practice, we get into the mindset of this evidence-based. But what is evidence-based? It means that there was a study that had to be funded. So who funded it and why? And how many studies are fund it before they release a study that tells the story that they want to share to promote their perspective. And then those studies, you have to pay to be in the study sometimes as an investigator. And you also have to pay to access the study as a physician. So it's not the sharing of scientific information and healthy discourse. It's something else.
Right.
So we're using evidence-based like it's the crown jewel, the gold standard. And I understand why, but we ignore all the other things, all the things that don't make it into a pharmaceutical-funded or university-funded study.
Exactly.
Right? The patient stories, their narratives, their culture, the prevailing beliefs in an area, all those things matter. And then we completely ignore energy and intuition. So things that we don't have a CPT code for or we can't explain, we say it's snake oil or it's fake.
Exactly.
Just because we don't understand it.
That's right.
Instead of being curious and diving deeper and learning and practicing, we just dismiss it.
Don't you think that since COVID has occurred, that there's a lot more curiosity just in people in general? I mean, there's a level of skepticism, no doubt. Now, we're in the South, we're in Texas, we're pretty independent-minded people to begin with. But I can tell you, I talk to more and more people that are very open-minded to getting with a medical practitioner that thinks critically. We're not talking process and procedure. We're talking critical thinking with the background and wherewithal to bring the best of Western medicine together with other, alternative is sometimes not the right word, but other treatments, more integrated treatments. They can work together, I feel like, and my personal opinion is, if they're delivered through a professional that has the background and the training to be able to do both. Your background being in emergency medicine, I think, lends you to be perfect to be able to practice in this. Because you, in general, you have to be a generalist and a specialist at all things and think quickly and be creative all the time. I've used this analogy a few times, but out of all the doctors, there's a hierarchy here. Let's not kid ourselves. Emergency room physicians are at the top of the food chain. They're like the Navy SEALs. They go in, they have things to do, and they knock them out, and they have to operate under pressure, and they have to be very smart. Not everybody chases to be an emergency room physician. It's a certain type of person. At these dinners that we go to, I can always kind of gravitate, I feel like, to the emergency room doctors because I think they're fascinating. They're very open-minded usually, but they're also very decisive. They can make quick decisions. So with a background like yours, and with where we are in our times of being post-COVID, don't you think the timing's pretty good to bring these novel treatments to bear?
I do. I think, to your point, at the opening, when you talked about the physicians getting together and having these private conversations, because they couldn't be public at that time. They had to be private, right? How are we treating this? Are we doing the right things? When do we send patients to the hospital? What do we do when they get there? Those sorts of conversations. So as an ER doctor, I was right in the middle of that. And looking at the guidance that was given. So when a patient came to the hospital, first of all, we told them not to go until they were dying. Like, you had to be pretty much blue and almost dead before they told you to go. But then there was no treatment or treatment options or conversation around possible treatments allowed in scientific discourse. We just had to listen to the authoritative forces and watch patients just get sick and almost die.
I have a perfect example of this. I am really passionate about it because I saw it firsthand. Close friend, actually, that I work with, came down with COVID, got very, very sick, goes to a major hospital system here in DFW. He had actually fainted. I think his oxygen levels were getting fairly low, et cetera, et cetera. Goes into the hospital. They run some tests. They say, hey, listen, you have COVID. You need to go home and hydrate. And I had, prior to him going, sent he and his wife, because I was glued to the news. Various sources. I'm trying to be as independent as I can and think through who is credible and who's not. But I was following some thought leaders here in the Dallas-Fort Worth area that were treating this effectively. Period. There's no argument to be made. I know them, and I know they were doing it. So I sent him basically, hey, ask these questions. Look at these types of treatments. They're available. He asked the question, and their response to two different people within that hospital system was, our system does not believe in this.
Right.
And he looked at him and said,
Right.
our system? But
Right.
I'm talking to you. You're a doctor.
Right.
He said, no, our system does not believe in it.
Right.
So it was just very interesting to me to watch him go through that, because he came, left, actually went to go see one of the practitioners that I recommended, immediately put him on a protocol
Right.
that they had success with. Within 24 hours, he was getting better.
Right.
And over the course of the next week, he was able to rid the virus and be just fine.
Right.
But for doing that,
Right.
I mean, I don't know where he would have gone. He had a history of having pneumonia and different things, could have been in the hospital. Next thing you know, let's vent the guy,
Right.
and he's gone.
Right.
I mean, how many people,
Right.
I know it's controversial to say, but how many people do we think we lost
Right.
to process and procedure
Right.
without critical thinking and using the ingenuity
Right.
of the medical community?
Right. And then I think the odd thing for me, when I went to medical school and I did the oath and learned, the language, and I was hook, line, and sinker in. We are, we are the healers. We are these important people. The relationship is sacred. We are supposed to be critical thinkers and use our practice and expertise in the art of medicine, individualized care. There's a difference between public health and public policy and me talking to you in the sanctity of an exam room about your life, right?
That's right.
And I honor that. When COVID happened, that was stripped away. We couldn't have those conversations or admit that we were having those conversations, even between a doctor and a patient.
Right.
You had a script. This is what you're supposed to say. If you say something different, it's misinformation. Well, nothing else has been misinformation. If I disagree with a particular medication or a course of action for an individual patient based on their feedback to me, I don't want to do that.
Right.
For whatever reason, religious or otherwise, we can come up with a new plan. Suddenly, that was taken away, and I watched colleagues be okay with it, which was weird. And then our medical societies fall in line. They didn't protect our right to be doctors.
Right.
Right. And so that's when I realized what's going on here. The censoring, we had colleagues on social media that, felt their medical licenses were being jeopardized just for asking a question, calling it, well, that's not science. I said, but that's exactly science. Science is exactly asking the question and investigating for an answer, and we couldn't do that.
Right.
So then the CDC came out with, oh, it's not airborne. You'll be fine with bandanas, scarves and bandanas, or handkerchiefs and scarves or something. That was when I started speaking out. I said, okay, so first of all, we know that coronaviruses are airborne. I don't understand this whole concept of 6 feet in plexiglass. If the building across the street is on fire, we'd be able to smell it here.
Right.
So you think that the air just stays 6 feet away from the other person, or you think this plexiglass. That doesn't make sense. If we put kids in schools and we put plexiglass around them, the only way it's effective is if we take away the air exchange, which would suffocate them in this glass airtight box.
That's right.
So none of this makes sense, right? So when I realized that, and then all of our medical societies came together, essentially, like all of medicine, it seemed, they've never come together on anything, right? Like disparities in healthcare, environmental toxins. There's a lot of big things, war. There's a lot of big things that doctors can come together, or doctor organizations can come together and say, hey, this is our stance. The only time that they've come together is to mandate the COVID vaccine. Just blanket.
Right.
Blanket. Like not check titers to see if you even need this vaccine, not get your history, take into consideration your personal preferences. We could not have those conversations publicly.
That's right.
Which is very odd. Like
It is.
It was very odd.
It is. And, I feel like, just as an opinion, a lot of the doctors that went through that, I think they kind of spun out and decided, hey, I want to focus my practice here. I want to be independent.
Right.
I mean, I've even advised my parents as we were kind of going through that period of time. I was like, I think one of the best things you could do is find a primary care physician, a concierge doc, preferably if you can, because you need an advocate. You need somebody in your corner. When things come up, they can kind of run the plays and they can run shotgun with you to the specialist.
Yeah.
Good doctors tend to run with good specialists and vice versa. But I feel like a lot of these doctors have kind of spun out and found their areas of focus. I also think a lot of the just population in general, community is seeking out more of these functional and integrative treatments.
Yeah.
And so it sounds to me like that moment with COVID kind of spun you over to say, all right, I want to take my ingenuity, my training, and my understanding, I want to apply it to help people with this.
Right. When I was a medical student, I was a senior medical student, we get to choose rotations, electives. And I chose what they called alternative medicine. I'm like, I want to do this. I want to expand beyond what you guys think you know about our existence and see if we can tap into that for healing. And they said, okay, I know, you could totally do that. You go for it. But if after you do that, we don't like it, then we're not going to give you credit for that. And I'm like, I am a senior medical student. I cannot do 6 weeks of a rotation and come back afterwards and the dean of students say, we don't like it.
That's right.
So I didn't do it, right? Yeah. I would be foolish to do it. So I did something else. I picked genetics or something, right? You know, but then, like I said, in 2019, 18 or so, I had the ability in my life, personally, financially, my kids were older, so forth, to start kind of investigating. And that's when I did my functional medicine training with a fellow nurse practitioner, and we were going to kind of start this practice. But then, like I said, then COVID came, so those plans changed. But to your point, COVID actually solidified something that was already planted back as a medical student that I was kind of starting to develop, calling it functional medicine at that time, not really integrative at that time. And then seeing, to your point, how restricted we are as physicians to practice the art of medicine, even the science of medicine, but the art of medicine, if we're being told what to do by the powers that be, whether it's insurance companies and CPT codes and you can't take this medication and so forth and so on, what type of interventions, surgeries, or just not honoring the other things that patients do that maintains health.
Yep, that's right. No, I couldn't agree more. I feel like as a lay person and people I talk to, my family, kids, you really have to advocate for yourself. But if you can find an outstanding physician that's smart and independent and critical thinking, it's probably one of the best resources that you could have.
I think so.
I really believe that. So let's jump into this a little bit. I want to give just even myself and our listeners a feel for what does this really look like? You know, I'm a patient. I come see you. Give me a feel for like what the experience is to be able to have a physician like yourself practice integrative medicine on me. Like, tell me a little bit about the evaluation. And I know it all depends based on what the presenting factors are, but maybe just give people a feel for what is this evaluation kind of like, and what are some of the tests that you might be running that a lot of people might not have access to.
Right. Well, I think that when people seek out this sort of, tends to be more of a cash pay. It's not, again, in the insurance system, so it's not reimbursable. So they tend to have exhausted that resource because they're paying for it, right? So when they come to see me, usually it's a long story of, hey, you know, I have this problem, that problem, this is what I've done, now what? I start off by listening, right? You know, an hour, sometimes two. Like, what's going on? What has your story been? I think that that's one missing piece that physicians are not allowed the privilege to have, is to sit and understand, listen for understanding to a patient, just talk and ramble if they need to kind of share the highlights of their experience.
Do you think it's because it's time? It
takes
takes time.
Absolutely. And it's not compensated, right? You know, your proceduralists make magnitudes more money than your generalist, although the generalist is the most difficult job because it's triage.
That's right.
I'm trying to figure out what's going on with you from all of the possibilities. By the time you get to a specialist, you've already identified the Big Dipper, right? It's right there. Now you just have to figure, I'm looking at the whole night sky, right?
That's a great way to look at it.
It's very, very time consuming. And if the time is not compensated, physicians are not afforded that time. I think there's an element of, I think that lawyers, you know, you would understand that cases require prep. Sometimes, you know, years of prep, months, weeks, at least days. Physicians don't get that.
No, they don't.
Isn't it weird that you're seeing somebody with a potentially complicated medical history, and the first time you're looking at that medical record is maybe 10, 15 minutes before you walk in the room?
It's wild. I mean, but it is the way it's done.
It's the way it's done.
I mean, our system is set up for this by how doctors are reimbursed, and then their incentive they have to build their practices in such a way.
Right.
But I feel like this is a general statement, but I feel like it's doing a disservice.
It is.
To our overall population.
It is.
I think we could help so many people, and we're going to get into more of the mental health aspects of this, but from mental health to just chronic disease management, understanding what we're really trying to treat here takes time and takes diagnostics and evaluations and critical thinking. And maybe even like we've talked about on other issues, just collaborating with other professionals to think through, hey, do you have any ideas on this?
Right.
No one, the system isn't set up to really incent any of that.
No. All that requires time, right? So all the things you listed, doing the background research on a patient story. So preparing yourself to engage the patient based on information they gave you prior to the encounter, right? Spending time with them when you're there to hear their version of events. Then after the visit, you're not going to know all the things, and that's okay. Again, night sky, lots of things, medical information doubles every 2 to 3 days. So nobody keeps up. It's not possible to keep up with all the new things. So now after our visit, taking the information given, I have to sit and think, what type of investigation would give me more information to help offer direction? That's going to be different for every person, but there are some main buckets that we look at, hormones, inflammation. So you can kind of get a general idea of that. So back to your patient experience, now where maybe the patient is in front of me telling me, what's going on. There are some great AI tools that we can use to kind of capture that and organize that information, or you can just kind of do it old school and take notes. I like the technology, but, depending. And then the work starts, right? The patient leaves. You say, okay, well, give me a few days, weeks, right? Months, maybe, depending.
Right.
And let me do some research. Let me offer some different investigations. Those investigations may take a couple of weeks to a month, sometimes longer, depending on the investigation, to offer results. Then you sit down with those results. So you can see, and the reason why I'm explaining this is because we've been conditioned as a society when we go to the doctor's spending 30 minutes with me or an hour with me. But if we're doing it this way, the doctor's spending an hour with you, but is spending 4 hours.
That's right.
2 hours of prep, 2 hours post, gathering all of the information, consolidating it, and then presenting it for delivery,
right.
Coming up with a plan, and then talking to you again. Let's reconvene. This is the data. This is my plan.
Right.
And sometimes patients are like, I'm not doing any of those things,
Right.
And so now we have to have another conversation. Like, okay, so what part of the plan didn't you like? Right?
What part can you do?
Right, what can you do? And maybe they're just not ready to do it. Maybe there's something that you missed in terms of their religion, culture, beliefs. So, and you have that conversation and you modify the plan. And then you're on a journey with a patient, and you're not so vested that if they make a decision that's separate from what you would make, that you're mad or you take it personal,
right.
Which I think in our current environment, doctors tend to feel emotional attachment to the outcome because the metrics reward outcomes.
Yep.
So, and now it's not your decision. It's
That's right.
Either you take this insulin and get your sugar to this level, or else my metrics look bad with my practice. And now Medicare, Medicaid, Aetna, whatever, doesn't want to reimburse me because my metrics are not where they should be, or your blood pressure is not where it should be, or this is a big conversation, your vaccine metrics are not where they should be.
That's right.
If you take away the incentives or the penalties and allow the relationship to be sacred, then that means that all these other metrics don't play into this relationship. And that's not how the system is set up.
That's right. That's right. And I feel like more than ever, like right now, the time we're in, I think you have more doctors that are setting themselves up kind of independently. Trained in functional, integrative medicine, various backgrounds, but probably a lot of them are internists that have decided, I'm going to go and work with less patients. And they have them. The model actually makes sense. I mean, I have a concierge doctor for our family, and it's great. And they can work with fewer patients. They have time. They can investigate. They can give you counsel. If you need to go to a specialist, they can advocate for you. They run through the traps. And to me, it's a win-win, because even when you look at like just health insurance in general and the costs for deductibles and patient responsibility, co-pays, And for what you can pay on an annual basis, and a lot of them are fairly, honestly, pretty affordable for a year.
Right.
And you're like, well, I can pay this. And then on the doctor's side, there still may be labs or certain things that can run via insurance, but they can build out their model to where it makes sense for them.
Right.
You know, it's a low-cost model using their ingenuity and smarts and, you know, have 100, 200 patients in your practice versus thousands.
Yeah, absolutely.
It's different. But it's on a macro level, it's frustrating because you're not really attacking the bigger issues that are affecting our society. Not everybody has access to that. So in some form or fashion, we're going to have to get this thinking, I think, through the system to really conquer some of these big, latent, chronic issues that we have.
I think that one of the things that comes up a lot, so I push back a little bit on, you know, I am aware of resource limitations, right? Whether it's societal or personal, especially personal. So we do go into, you know, is it elitist or is it fair? Or, you know, those sorts of conversations. But the reason why I push back on it is because people pay for what they value, period. So you could be as rich or as poor, but nothing else matters if you are not sick. I mean, if you're not healthy,
That's
you're
exactly
sick.
right.
And so you can invest in wellness or you can pay for sickness. And to your point, insurance, after you pay the premium, the co-pays. For instance, an MRI, I had a patient who needed a breast MRI because the mammogram showed some things, ultrasound, dense breast, so forth and so on, needed an MRI. And the insurance didn't want to cover it. And I said, but it's $500 cash. Like cash. You can go get an MRI with and without contrast, whatever the radiologist says you need, right? And it's $500. But if you take your insurance, the price is $4,300, of which your part is $500.
Right.
You know what I mean? So just go and pay cash for what you need. You know, when I needed to see a doctor, I wanted to see a neurosurgeon that was not limited by insurance. So I asked colleagues, who's the best neurosurgeon in this area? And I called the office and offered cash. I don't know if he's on my insurance or not. How much is it to see the doctor?
That's right.
And they said $125.
Unbelievable.
So you're really letting insurance dictate your care
Completely.
over $120. That is your copay. You'll probably get a bill back from Blue Cross saying that you owe $75 for that doctor's visit.
Right.
You know, so I think that we have just been conditioned to think, one, we can't afford it, or two, we shouldn't have to pay for it. And it's an area where it's odd because it's one of the most valuable things you can have is your health and an advocate in your health. Yet we don't think that we should pay cash for it.
I couldn't agree more with everything that you said. My hope is that maybe through the great tragedy of COVID and all the lost lives, and maybe we have an awakening that's sort of happening in our society, and we can break down some of these things moving forward. But I agree with you. Well, hey, I have to tell you, this has been a ball to have you on here. I really have enjoyed getting to know you. This has been a great discussion, and I think God's given you a gift, and I just thank you for working on it.
Thank you.
So thank you for being on our show.
Yeah, thank you.